Hello, my name is Liyayi. I'm a student at Capit State University taking family nurse practitioner course. Uh, this semester I'm taking pediatrics, and it has been a good experience, I would say. Initially, when I started doing pediatrics, I was afraid and I was anxious. I would admit to that. I set my goals to try and learn how to handle children, since that has not been, I have not had that experience before. So this was my first one, and I was intending to kind of try to go about it in a manner that will not make them scared or make them feel that I'm intimidating them. So I had to kind of look at myself and try to make myself acceptable by those children. So I set the goal to try and learn as much as possible in terms of differential diagnosis and in terms of doing their physical assessment, learning their milestone. The milestone kind of felt much challenging initially. I felt like I may not be able to master that the milestone well, but with time I have learned to master and be able to tell where a child is supposed to be when they present themselves. So my bias and my prejudice was that pediatric population was the most challenging when it comes to taking care of sick people, and I was thinking probably I may not able to take care of them, especially since they are very delicate, since they cannot tell what hurts, they cannot be able to express themselves. The pointing the red flags was, I felt like I may never be able to do that. Also, when I think of I have to deal with the parent, and the parent is anxious when they bring their children to you, so they expect you to be able to come with all the solutions to their children's problems. I felt I was kind of um, felt like that population is difficult to take care of until now. Now I'm thinking differently. My thoughts have redirected to thinking positive about children. When I come to my anxiety, the way I was able to tackle it is that my preceptor, Dr. Setlow, and Miss Connie, they have been very, very, very vocal and helpful when it comes to orienting me in terms of pediatric populations. They took me step by step in terms of assessments, doing the assessment, doing differential diagnosis, uh, taking the histories, taking the diagnostic testing, and looking at the red flags. At some point, it was challenging, but as time came by, things started becoming easier. And for example, I was able to do an assessment and be able to pick out on a diagnosis. There was a case that was presented, one of the cases that was presented to me out of many that I have seen. I'll just give one example of a patient who presented, 6-year-old Hispanic child who presented with itchy red eye that was crusted with the yellow drainage. I kind of looked at the child and tried to isolate what could be wrong. I could see probably it could be conjunctivitis. I tried to look at the differential diagnosis. Is it conjunctivitis? Could it be corneal abrasion? Could it be eye trauma? Could it be iritis? Kind of thought about the differential diagnosis that could have presented in such a scenario. When it comes to conjunctivitis, I also thought about allergic conjunctivitis, bacterial conjunctivitis, chemical or viral, and all those came into my mind. So I decided, where do I start? I should start with the history. I took the history. Is he allergic to any medication? Has he been exposed? Is the pain? I use the old cats to assess the pain. I also looked at the family. Was anybody sick in the family? Was there a trauma? Was he exposed to any trauma? I looked at all those things. In the physical assessment, I just looked at the vital signs to rule out infection. I looked at the eyes, breath sounds, if there was any respiratory involvement. I looked at the lymph nodes, ears, throat for any possible infection. I kind of narrowed down, and I came to look at when I look at the differential diagnosis and the red flags. I kind of saw, like, if it was viral, it could have had watery discharge, and usually viral has bilateral involvement. When it comes to chemical, there was no history of exposure to chemical. When it came to trauma, there was no history of trauma. There was no allergic conjunctivitis, no bilateral involvement. So I came and narrowed down to bacterial conjunctivitis, because this one kind of showed clearly that it kind of showed clearly that there was some mycopurulent drainage, and the sorry there was, sorry about that, there was the mycopurulent drainage, and then there was erythema, there was pain. All those are symptoms of bacterial conjunctivitis. Since that case was presented, I kind of gave myself credit, because I was able to kind of narrow down to whatever diagnosis, and then recent cultures, eye cultures, and brain stain, so that we can find out whether it is tentatively the bacterial conjunctivitis. I also looked at the best treatment, which was Cipro, which I kind of prescribed for the patient. This experience, reflection is good, because right now I look back at how I used to do those things, how I used to do my assessment, and I've seen my improvement when I look back to what I used to do. So I would kind of like to continue with reflection, because it kind of gave you an insight. Sorry. And it encourages you, it gives you encouragement, and gives you confidence that you see where you come from and how far you have come. Thank you so much. I appreciate Dr. Rees for giving me this opportunity to kind of express myself in terms of taking care of pediatrics population. Thank you very much.